We're here at Cornbrook GP practice in Hume, near central Manchester. This practice has been prescribing plants for people that are suffering from anxiety, depression and social isolation. My name is John Ross and I'm from a social enterprise called Sow the City, and we empower communities to grow and live sustainably. And we've been working at GP practices all over Manchester with patients that are in need of more nature really. We've found that it's been really therapeutic for a lot of people.
Okay, so this is really just the patch of ground at the back of the surgery, and I think it had originally been planned as a wilderness garden, but it had become truly wild and a bit of a rubbish dump. So we had the idea of clearing it out, and with help from Sow the City, we've transformed it into a really lovely place to be actually. The idea is that we have groups once a week where patients come, and we've been developing the garden together, thinking what we're going to have next year, planting plants and vegetables and tending it. So that's part of it. And then we have the Prescribe a plant scheme.
Prescribe a plant is where we give a patient a small plant to take home, normally a herb, but it can be anything, and they can grow it at home, look after it, and then they can bring it back to the garden, plant it here, or they can plant it in their own garden. And it's just a way we can give the patient access. We can introduce them to the garden and they can access other services through it in other companies.
Well, there's definitely evidence that people who spend time in a green space have much better mental health, but it's more than that, isn't it? Because it's also about being with other people. The physical activity of gardening is very good for you, and you can do it at whatever level that you're able to do it at, be it digging out a tree stump or planting a few seedlings. So to be able to come down here and hopefully take away some of the skills to grow things back home, that's what we're hoping to develop.
So we do a weekly gardening session where we just sort of do general garden maintenance, and what we do is really led by what the volunteers, what the patients want to do.
I've had 2 heart attacks, I've got 3 herniated discs, I've got diabetes as a result of putting all this weight on, and I used to have my own allotment which I shared with my nephew. Unfortunately, due to work commitments, he had to give it up and I just couldn't manage it myself. So one day, 2 years ago, I was coming to see the doctor, not here at Booth Street, and this had just started. My doctor, Dr. James, said, "This has just started, do you want to give it a go?" And I said yes, so I came along, and what I found is I can, first of all, I can still do a lot of the stuff I used to do on my own allotment, but in a way where I'm not actually forced to do all the heavy work that I can't manage, because there's other people around here helping. Because it's outside in the open air and it's the fresh air, it's good for me with all my conditions. So that's one of the main things I get out of it. It's social, it's community, it's really good. And I think taking a plant home, the prescriber plant, to look after is really good, because again it gives them a focus. They've got something there to look after. So, and if you look around, there's not many houses that have got gardens, open spaces, flats, houses with yards, so people don't get the opportunity to do this. So that's why I think it's really, really good, not just for me but for other people as well.
Social prescribing has come to the fore in recent years, and what that actually means is it's a way of caring for people in a non-medical, clinical way. And I think the relevance of Sow the City in terms of social prescribing is it covers a number of areas which are very beneficial to the individual. So in terms of what this achieves, 1, it gives people exercise. 2, it prevents social isolation, brings people out of their homes, can support longer term conditions such as type 2 diabetes by enabling them to not only grow but eat healthy food. And of course, in terms of mental health, I think it's well proven now that working in green environments is exceptionally good for people. You know, I think that Sow the City, the staff, the patients, members of the community that are all involved in this project should be incredibly proud of what they've done. It's clearly already reaping rewards, and you know, I think again it's a really good example that many others could follow, and certainly we've learnt a lot of lessons from this type of work.
So we've been really pleased with the project. It's been beneficial for a huge range of people in Hume, and we'd love to hear from other schools, from GP surgeries, hospitals, people that run parks, and maybe we can set up similar projects at other places around the city.